So someone wanted to know about the OKN drum and how we use it in neuro-ophthalmology. And if you're wondering what an OKN drum looks like, it looks like this. It's a drum that rotates, and there's alternating white and black stripes. And the reason we use it is by rotating the drum, the patient fixates on the target and then has to saccade back. So they're pursuing in one direction as the drum is rotating, and they have to saccade back to the next target. So it generates both a pursuit response and a corrective saccade response. And so the way we use the drum is to see if someone can see if they claim they cannot. So if someone, for example, claims they have no light perception vision in both eyes, and you're wondering whether they actually can see something, you can take the drum and you can spin the drum, and it will generate an nystagmus movement like this. So if they see this rotation, they'll have a nystagmus. And if it's only one eye, you can cover the good eye and keep rotating the drum. So we rotate with both eyes open, and then all of a sudden we cover the good eye. And if the eye that is fixating can still jump, then they can see something. So a drum like this is good for bad vision only, like hand motion or light perception, because the stripes are so big. So that means someone who's 20/80 or 2100 might legitimately still have a positive OKN, even if they're blind. They can't see the central spot. So we can use it for either one eye, OD or OS, or two eye, bad vision, NLP, LP. The other way we can use it is to test for the pursuit function. So as you're pursuing, the OKN will generate a corrective saccade. And so you have an asymmetric pursuit, like in a parietal lobe lesion versus an occipital lobe lesion. The pursuit will be abnormal in the parietal lobe lesion because that's where the parietal pursuit mechanisms start. And so if someone has a right homonymous hemianopsia or a left homonymous hemianopsia, and we spin the drum, if it's occipital in origin, it'll be symmetric, but it will be asymmetric if it's a parietal lobe lesion causing the homonymous hemianopsia. The other way we can use the drum is vertically, like this, and that's going to generate the pursuit down and a saccade upward. And that's good for the dorsal midbrain syndrome, because when someone tries to saccade up and they have the dorsal midbrain syndrome, they might get convergence retraction nystagmus. So it's one of the ways we can elicit convergence retraction nystagmus in the dorsal midbrain syndrome by rolling the drum downwards. So OKN drum, useful for testing for non-organic functional visual disorders in severe vision loss, one or both eyes, testing for the pursuit function in parietal lobe lesions producing homonymous hemianopsia, and for bringing out the dorsal midbrain syndrome convergence retraction nystagmus.